Hello folks, this is Ed Michael from Railroad Workers United, held away from Home Terminal TV. Today I'm coming to you from Chicago, Illinois. I'm here with Brother John Flanders at the Labor Campaign for Single Payer Healthcare. John, first of all, tell us a little about yourself.
Well, I'm a railroad machinist for the last 25 years, past president of my local, currently Vice President of the Troy Area Labor Council on the steering committee of the Labor Campaign for Single Payer.
All right, and what are we doing here today, or this weekend, John? I'm sorry.
Well, this is the second conference that the Labor Campaign has had. The first one was in 2009 in St. Louis, and it was formed to take on the whole question of getting a sane and rational healthcare system in the United States instead of the profit-driven one we have currently that costs us a fortune and doesn't cover everybody and denies care to so many people. And this particular conference was held after, the first one was held before during the discussion and before the adoption of the Affordable Care Act, known as Obamacare. This one is held after and is dealing with the results of that, the coming implementation of that legislation, which for labor has a lot of downsides, as was discussed this weekend.
I know this is my first time at a single-payer healthcare conference, and I've learned a lot. And one of the things, that really strikes me is, we took a pretty good hit, or we all believe anyway we did, and I think we did, on our healthcare in our last contract, and we're paying quite a bit more now out of pocket. Have you seen, like in your shop back home at Selkirk, have you seen any effects of the changes in our healthcare insurance?
Yes, we have. Particularly, 4 members of my machinist local are young fathers and have had children under this new contract, and all of them have experienced a huge increase in cost. If they had a first child, it might have cost them one copay of $20 or something. Now it's anywhere from $700 to $1,000 for a birth. That's assuming no major complications or anything like that, because of the increased number of copays, the deductible, co-insurance, and everything else. It's going to cost you a lot more now to have any procedure in a hospital that's significantly expensive. You're going to pay a portion of it.
One of the things I've learned here this weekend is that the Affordable Care Act and Obamacare does do some good things for people that don't have insurance, but for those of us in labor whose insurance is healthcare insurance is established by collective bargaining agreement, it doesn't really do us much favor, especially those retirees that retire at 60 before their Medicare. It kind of puts our insurance in a little jeopardy. Do you just your own personal opinion, John? Do you think the changes are going to affect the negotiations in our next contract on health care?
Well, without a doubt, because we have had a fairly decent health insurance program compared to a lot of people, but because of the excise tax on plans costing more than X amount of dollars, I think it's $18,000 or something like that per employee, it's very likely that we may be bumping up against that in the next, if we haven't already, in the next round of negotiations. And the employers are going to use that, although they pay the tax, they're going to use that to say they can't afford this, they can't afford that, and they're going to want to increase deductibles, they're going to want to increase co-pays, co-insurance, and all the rest of it. So there's no question in my mind that that's going to affect their next round of negotiations. And by the way, in terms of the currently uninsured, it's very likely that all they're going to be able to get is poor insurance with high deductibles, with money going from the taxpayer to the insurance companies as a result of all that.
And I agree with you, John. And I'm going to shoot one last question to you, and it might kind of put you on the spot, but rank and file railroaders, what can we do?
Well, rank and file railroaders need to get educated about the alternatives to the current private insurance, employer-based health care, because it's going nowhere fast. And they have to put pressure on their union leaders to get involved in the fight for single-payer national health insurance. The problem is right now that a lot of unions are officially in favor of single-payer, but are not committing any resources to funding it. I mean, if in cases of, like in California, where it was discussed this weekend, where they had Proposition 30 or 32, one of them that would have really crippled unions in that state. The unions spent millions of dollars to defeat that proposed legislation by referendum. That's the kind of resources that are going to have to be committed to a fight for a national health care system. It hasn't happened yet. This organization, the Labor Campaign for Single Payer, is functioning on what one person here described as a budget for a small union local. And it's nowhere near, at this point, the resources that labor potentially has, and spends millions of dollars on candidates that end up not doing us any favors. That's what you have to do to fight for this kind of change in the whole system.
Thank you, John, very much. I appreciate it. And brothers and sisters, this was Railroad Workers United, Away from Home Television.